بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My short talk today is about dental X-ray basic anatomy. As we know that dental X-ray see the tooth and beneath of the gum to assess the health of the bone and supporting tissue that hold the teeth in place. And there are number of X-rays for dental profession and can be divided into intraoral and extraoral. The intraoral is the occlusal film and the extraoral is the panorama and the CT scan. In this short talk, I will talk about the occlusal intraoral anatomy. And we can these X-rays helpful in finding the cavities and look for the tooth roots and check the health of the bony area around the tooth and determine if the periodontal disease is oral care issue and see the status of the developing teeth and monitor good tooth health through the prevention. As we said, we have the panorama and it shows the teeth and jaws, nasal cavity, sinuses, and usually taken when the patient may need orthodontic treatment or implant placement. The occlusal film offers a clear view of the floor of the mouth to show the bite of the upper and lower jaw, and this kind of X-ray highlighted children tooth development and show primary and permanent tooth in adult. As we see here, the tooth it is composed of two components, the crown and the root, and these the animal. This is the cap, and it is below it. It is the dentine, and below that it is the bulb, and from the bulb we have the root canal, and the root canal it is surrounded by cementum, and the cementum it is surrounded by periodontal ligament, and the periodontal ligament it is surrounded by the lamina dura. As we said, the root has two parts, the crown and the root, and we have the animal, and it is radio opaque, and the below it is the dentine, and it is less radio opaque. And the animal is covering the crown, and it is strong, hardest material, and does not have nerve supply. The dentine, it is less radiopaque comparing to the enamel, and there is interface between the dentine and the enamel, and will identify the two structures as we see here. This is the radiopaque, it is the enamel, and less radiopaque is the dentine. And the bulb, it is the radiolucent, and it is composed of soft tissues and extend interior to the root abscess, as we see here, extend anterior to the root abscess. And the root canal, it is surrounded by radiolucent area, radiopaque area called cementum. And it is thin, calcified, covering the root. And it meet the enamel of the neck of the tooth, and has no nerve supply, and also covers the dentine, so that this is the nerve root canal, and the root canal, it is covering by cementum, and the cementum, it is covering the dentine, and it is extend to the enamel and has no nerve supply, and it is attached to the periodontal ligament. As we see here, this is the periodontal ligament. It is radiolucent line surrounding the cementum, and it is composed of collagen tissue, and it is surrounded by the lamina dura. The periodontal ligament attached to the root to the alveolar bone of the jaw, and has both nerve supply and blood supply. And this ligament provides elastic cushion between the tooth and the bone. In summary, we have the enamel, and it is radiopaque, and beneath the enamel it is dentate, it is this radiopaque, and we have radiolucent. This is the bulb, and the bulb has root canal and to the root abscess, and the root canal, it is surrounded by cementum, and the cementum, it is covering the dentate, dentine, and extended to the enamel, and the cementum, it is covered by periodontal membrane, and the periodontal membrane, it is covering by lamina dura. The lamina dura, it is a thin radio-opaque line covering the periodontal membrane or ligament. Again, here this is the summary of the dental anatomy, and we have the more radiopaque, it is the enamel, and below it, it is dentate and bulb cavity, the radiolucent, and the root canal, and the root canal, and we have the root, and this is the distal root, and the root canal, it is surrounded by the cementum, the radiopaque, and The cementum, it is surrounded by radiolucent, it is periodontal membrane, and the periodontal membrane, it is surrounded by thin radio opaque, it is the lamina edura. And the bone between the both teeth, the alveolar bosses surround it is gingival margin of the alveolar bosses which surround the teeth, and it is about 1.5 millimeter or less, and shows apical recession with age or periodontal disease, as we see here between the teeth. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.